The main indicator of clinical depression is usually a staying low, depressing, or desperate mood, while anxiousness generally involves difficult emotions of worry, stress, and concern. Anxiety can easily also lead to alcohol-related craziness. It may be helpful to look at the emotional condition underlying each clinical depression person's mental state. The symptoms of each ailment are discussed in information. A medical diagnosis once detected, folks should discuss their ailment with an experienced psychotherapist or psychologist. But these ailments do really discuss a number of key indicators. To begin with, they also suggest that while the nation as a whole might not be able to stop global warming because of international warming, in a lot of instances, it can be turned around. The final trait the majority of folks wished was to shed control of its C's and C's to C-degree growth. Second, because most weather improvement skeptics assume environment modification is a scam, this documentation might show to be a solid sign that worldwide warming is actual. Anxiety, for example, commonly involves frustration, and some people with depression may feel much more cranky than depressing. When talking about how to cope along with anxiousness, a new therapy for PTSD appears to be one that incorporates these two elements all together. In a paper just recently released in Psychological Science, analysts at Stanford University presented a system of treatment for PTSD that includes anxiousness and anxiety-related signs and symptoms. Since these ailments may show up differently from individual to person, you might not consistently understand specifically what your indicators indicate. If you go to a seminar in your workplace, it is possible to discover more about detailed signs and symptoms of stress and anxiety, so you can easily communicate extra properly when you are certainly there. The mental wellness perks of stress and anxiety speak may be far even more efficient than what you'd usually hear on television, and you'll see even more outcome in professional method. It's likewise feasible to have both anxiety and anxiety at the exact same time. A worldwide survey from 2015 found that 41.6% of people disclosed possessing both primary anxiety and stress disorder during the course of the very same 12-month time frame. Various other studies, in the meantime, have recommended that people who have bipolar condition may possess less clinical depression and a lot more troubled and taxing life celebrations after taking antidepressants. Additional investigation is important to exemplify the source of depression and stress and anxiety. One important point: depression and anxiousness possess in typical. In each instances, folks adapt with the stress that they experience at the time after upsetting take-in. And what does that imply for everyone else? The study found that individuals who were a lot more troubled and depressed experienced a lot less anxiety overall after the injury, a reduction in depressive signs and lesser distress levels when matched up with those who were much less troubled and depressed additionally during the course of therapy. Both may strengthen along with support coming from a psychological health expert. The brand new component may also offer a motivation to read and organize for your rest patterns.